Good morning, and thank you all for coming today, and welcome to Senior Day at the Illinois State Fair. I want to thank Director Costello and his staff at the Department of Agriculture for helping us and to host us today. Our department is in charge of providing services to older Illinoisans over 60 years old of age, and those who basically also are looking for services throughout the state. The past year has been challenging for all of us, but especially for our older adults. The COVID pandemic has impacted older adults the hardest, and the aging network has stepped up time and time again. We have met basic needs for those seniors, and we have ensured that they have everything they need to stay home and stay healthy and safe. Some of the things we've been doing is delivering home-delivered meals, of which we have done 1 million meals a month throughout the state of Illinois so far. We have also been able to help isolated seniors so that they can stay connected to their loved ones through assisted technology. This year's theme at the State Fair is One Illinois. And Illinoisans were resilient and came together during the pandemic to volunteer and to support our older adults in need time and time again. Whether it was providing transportation to have access to COVID vaccines, or to prepare an ethnic meal, or to do grocery shopping. The Aging Network's commitment has never faltered and has been steadfast. The Pritzker administration's commitment to our older adults is evident, as outlined in our department's fiscal year 22 budget. We have ongoing funding for our emergency senior services programs, again, our home-delivered meals, and funding for programs for social isolation and support for our caregivers, as well as increased support for our direct care workforce. From our ever-expansive services in the community care program, to our senior helpline, and to our 24-hour adult protective services hotline, we are here to assist with our aging population, their caregivers, and the service providers that give all the services and tools to all of those seniors throughout the state. Today in Illinois, there are 2.7 million individuals who are 60 years of age and older. And another staggering fact is that people who are 85 years of age and older is the fastest growing population throughout the state. By 2030, it is projected that over 400,000 people will be 85 years of age, and that's an increase of 109% from 1990. Illinois has been very successful in getting our older adults age 65 and older fully vaccinated, with over 80% fully vaccinated throughout the state. I think we may even be up to 90% now. So we're very pleased that people are getting vaccinated, because we know that this is the key to independence and maintaining one's overall health. And we want to make sure that people have every opportunity to get vaccinated. We're really pleased that in our senior building today, because it's Senior Day, the Department of Public Health is going to have vaccinations all week long in the building. So we hope that they'll stop by. And on that note, I would like to take a moment to thank our sister agencies, our sponsors, for helping us put today this full day of activities. And we want to make sure that you know that there's lots to do. So please, again, please stop in. I am extremely honored to be standing here in front of all of you today with Governor Pritzker, and want to thank him for his leadership during this pandemic. I want to make sure again to say that we have a range of activities going on in Senior Day. There's health screenings, blood pressure checks, all kinds of things that we want to make sure that you take advantage of throughout the day. But one of the things I would like to highlight today, though, is that no one likes to talk about it, but it is something that happens, which is elder abuse. And elder abuse, unfortunately, happens every single day. The Department on Aging every year has responded to more than 20,000 reports of abuse of adults age 60 years of age or older, and those who are disabled, 18 to 59 years of age. And unfortunately, that number continues to rise. As Americans, we believe in justice for all, and yet we fail to live up to this promise when we allow members of our society to be abused or neglected. But make no mistake, Abuse can take many different forms, and I mean that this can include financial exploitation, emotional abuse, passive neglect, willful deprivation, things like that. Many times these things happen in tandem with one another. But don't worry, in so many ways we want you to make sure to hear there is help, and we are here to help you. And so I would like to thank the Alzheimer's Association and all of our legislators for their work on passing Senate Bill 677 and House Bill 848. Senate Bill 677 helps ensure that those at risk of cognitive decline receive the quality care that they need by requiring healthcare professionals who have continuing education requirements to complete a training that will truly look at the diagnosis of Alzheimer's and other dementias so that they can take care of those folks they come in contact with every day that they do their work. And with each training, they will tack that on to their license renewal period. Also, House Bill 848 allows for the special scratch-off lottery game, which benefits Alzheimer care, support, awareness, and education. And this is going to be extended through January 1st, 2025. In addition, I would also like to thank the legislators and stakeholders who worked to pass House Bill 2570, which helps make discounted liability insurance for older adults more accessible by allowing for an e-learning version of the National Safety Council Defensive Driving course. And so, without further ado, it is my extreme honor and privilege to introduce to you the governor of the great state of Illinois, Governor J.B. Pritzker.
Well, first of all, thank you very much, Director Basta, and to your staff and all the people who've been involved in putting today together, and of course are providing so many services for our seniors. Just want to express my gratitude, my sincere gratitude for all of that. Very, very hard work. I also want to thank our Director of the Department of Agriculture, who has been working for months preparing with his staff for the State Fair and has done a terrific job and joins us today. Thank you very much, Director Jerry Costello. I'm very excited today to sign 4 pieces of legislation that will make Illinois an even safer state for seniors as we honor Senior Day here at the Illinois Fairgrounds. I'm very glad to have our bill sponsors here, Leader Dan Brady. We have virtually Senator Ron Villaraigosa, Representative Kathleen Willis, and again virtually Representative Natalie Manley, along with Senator Steve McClure and Representatives Tim Butler and Mike Murphy. I also want to recognize sponsors who could not be here with us today. Those include Senators Melinda Bush, Tom Cullerton, and Leader Omar Aquino. Together, the steps that we're taking today mark a bipartisan commitment to ensuring that Illinois seniors can live their best lives. That starts with our effort to expand Alzheimer's awareness and to bring the world closer to eradicating this heartbreaking disease. This is work spearheaded by our very own Lieutenant Governor, Juliana Stratton, who will speak in just a moment, who has made it her mission to show Illinoisans whose lives have been recast by this disease that they're not alone. I also want to recognize the leadership of the Illinois Alzheimer's Association, which has operated hand in hand with the Lieutenant Governor and with the General Assembly to make ours a kinder state for those dealing with this terrible condition. This law makes Illinois the first state in the nation to require regular Alzheimer's diagnosis training for all licensed adult-serving healthcare professionals. As it stands, Alzheimer's is a vastly underdiagnosed disease, leaving far too many victims and their families maneuvering the changes in their lives without any help. They deserve something different, and with this bill, many of them will receive it. Addressing Alzheimer's and ultimately ending it requires resources. So another bill that I'm signing today extends the promotion of our Alzheimer's scratch-off ticket until 2025. Nearly $1 million has been raised since the ticket's inception last year, and I'm very proud that we can maintain this effort for years to come. I'm also signing two bills that reflect the lessons we've learned from the COVID-19 pandemic. First, we're making it so that seniors who complete an online defensive driving course versus an in-person option can still be eligible for an auto insurance discount. Second, we're requiring access to virtual communication at all of our long-term care facilities in Illinois, so residents and their families will be able to reach each other, to be part of each other's lives, even if circumstances require physical separation, as has been a requirement during the COVID-19 pandemic at times. So again, I want to thank Director Basta for hosting a spectacular senior day at the fair today, the elected officials in attendance for spearheading these important bills, and to all of the care providers and those who are part of the Illinois Alzheimer's Association who support our seniors every single day. With that, I'd like to turn it over to really a leading voice for today's progress and my steadfast partner in governance, and that's our Lieutenant Governor, Juliana Stratton.
Governor Pritzker, thank you so much for that kind introduction. Every single day I'm proud to be your partner as you lead this state with courage and compassion. Good morning, everyone. My heart is full this morning because it's senior day at the Illinois State Fair, and seniors really hold a special place in my heart. In fact, I believe that we should celebrate our seniors every single day for the care you've given, the lessons you've taught, the wisdom you've shared that has guided us along the way, and the love that you give not just to your families, but to entire communities. Illinois is a better and stronger state because of our seniors, and we stand on your shoulders. These bills being signed into law today reflect our administration's commitment to ensuring that our seniors get the best resources and care that the state has to offer because you deserve it. All of the bill sponsors have already been acknowledged, so in the interest of time, I'll just say thank you to each of you for charting the course for our state to have more resources to assist with Alzheimer's research, expanded access to health care by lowering auto insurance rates and premiums for those 55 and older, and keeping those in nursing home facilities connected with their loved ones. These are just some of the ways that we are making Illinois a great state in which to grow older and live your best lives. And I'm grateful to Director Paula Basta and her team at the Illinois Department of Aging for helping to lead the charge. As was mentioned, some of you know that I am especially proud of Senate Bill 677, which was drafted based on the stories that I heard throughout the state from caregivers and those living with Alzheimer's during my 6-month Through Our Eyes campaign. This bill is personal to me, as I was the primary caregiver for my mom, Velma, during her final 3 years of life. As her caregiver, I took my mom to the doctor on a regular basis, but despite this fact, her healthcare professionals never detected the signs of Alzheimer's until it had already advanced. We were all totally taken off guard. And now with the governor's signature, and thanks to chief sponsors, Senator Ron Villaraigosa and Representative Kathleen Willis, and so many Illinoisans who shared their personal stories of the difficulties of getting an Alzheimer's diagnosis, Illinois is now the first state in the nation to require training for healthcare, adult-serving healthcare professionals in diagnosing Alzheimer's and other forms of dementia. In other words, we are trailblazers. And as the chair of the Illinois Council on Women and Girls, it's important to note that not only do women make up 2/3 of the caregivers in the United States, But women also make up 2/3 of those diagnosed with Alzheimer's. So this is a matter of equity, and it's a matter of lifting up Illinois' women. Governor Pritzker, thank you for your commitment to building a more equitable and inclusive Illinois, and for taking action today to improve the lives of our seniors. And thank you to Delia Gervier and the Alzheimer's Association Illinois chapter, as well as all of the advocates and members of the General Assembly who made today possible. Finally, I'd like to thank my adult daughters, Tyler, Cassidy, and Ryan, who began this journey with me, not as the family of the Lieutenant Governor, but as a support system as I cared for my mother. And I appreciate the love they showed me and their grandmother. I could not have cared for her without you, and I would not be where I am today without you. Now, I would like to bring Governor Pritzker up to introduce the next speaker. Thank you.
Well, through the magic of the internet, we will have our first virtual speaker, and that's one of the sponsors of today's measures, and that's Senator Ron Villaraigosa.
Good morning. Thank you so much, Governor Pritzker, and my wife, who is 12 days out from our due date for our second kid, very much thanks you and your team for allowing us to participate virtually. As was mentioned, my name is Ron Villaraigosa, and I represent the 8th State Senate District. I'm so honored to have been a part of the work that has been done in our state to provide better care and other services for our seniors. I am also honored to have been the sponsor of Senate Bill 677, legislation that adds Alzheimer's and dementia training to the license renewal process for doctors and other healthcare providers. According to the Alzheimer's Association, more than 6 million Americans live with Alzheimer's disease, including over 230,000 in the state of Illinois. Currently, less than half of people living with Alzheimer's ever receive a diagnosis, unable to plan for the future, ineligible to participate in clinical trials, and unable to access vital resources. Diagnosing Alzheimer's early is essential for receiving the best treatment possible. This new law will better enable healthcare professionals to identify and recommend resources for patients showing signs of dementia. I want to thank Governor Pritzker for his support, Lieutenant Governor Juliana Stratton for her tireless efforts, as well as sharing her personal story over the course of the last year and a half and more. Representative Kathleen Willis for being the House sponsor, the Alzheimer's Association, the Illinois State Medical Society, and my colleagues for their collaboration and support as well. We have taken a giant step forward today on behalf of Illinois seniors, and I want to thank everyone again.
Next, it's my honor to introduce the other co-sponsor, the House co-sponsor of the bill that the senator was referring to, and that's House Representatives Leader Kathleen Willis.
Thank you, Governor. It is a pleasure to be here today, representing not only the 77th District, but the state of Illinois and all of those that are affected by Alzheimer's. 230,000 Illinois residents suffer from Alzheimer's disease. Early diagnosis is key to the best course for treatment. That is why I was pleased and honored to work not only with the Alzheimer's Association, but with Lieutenant Governor and all of our healthcare professionals throughout the state to make sure that we could increase diagnosis and screening processes for our seniors. We know that this is a step in the right direction. I am extremely proud to have been the House sponsor for this bill. We know by doing early screenings, we will go and help others as we go forward. I am so proud of the work that we've done with this. It has been a joy to work with the Alzheimer's Association. It has been a joy to work with the Lieutenant Governor. Her passion for this, as you heard in her speech earlier, goes beyond anything else. This is something that I am proud to have as part of my legacy going forward, to make sure that we can go and make sure we have early diagnosis for the best course of treatment. I am happy to see that the governor will be signing this into law today, and thank you all for allowing me to be here. Thank you.
And next, I'd like to introduce Leader Natalie Manley, who will be joining us virtually.
Good morning, everyone. Thank you, Governor. Appreciate everything that's going on today. Wish I could be there with you personally, but appreciate the technology that we've now been able to embrace and make this a part of our daily life. I'll be brief. I'd like to reiterate some of the words that my colleagues have mentioned here this morning, but I want to be clear in my appreciation to both you, Governor, and Lieutenant Governor. Your leadership in fighting this disease has been key. On behalf of the people in the Illinois 98th House District and myself personally, thank you for always making the health and well-being of the people of Illinois a priority. And thank you for working with me and my colleagues. And today is a great day. Thank you, everyone.
Next, I'd like to introduce House Leader, Republican Leader Dan Brady.
Good morning and welcome to Senior Day at the Illinois State Fair. Governor and Lieutenant Governor, my House and Senate colleagues, the directors, thank you all for being here today on this important day of legislation. House Bill 2570, this new law, opens up access to driver training to more mature drivers in Illinois. Through e-learning, Illinoisans 55 and over can easily access this instruction, the instruction that they need not only to stay safe on the roads, but also to reduce their vehicle insurance premiums. It is a piece of legislation that received strong bipartisanship support, and a piece of legislation that I thank my Senate colleague sponsor for as well. And for all those in the House, I greatly appreciate my colleagues' help and support. And to the agencies of the AARP, the Institute of Safe Driving, the Illinois Insurance Association, and other stakeholders, I thank them for their help and support of their many resources. And to the National Safety Council right here from Illinois. So with that, thank you again, Governor, and thank you for being here to sign the legislation. It's now my pleasure to introduce the Executive Director of the Illinois Alzheimer's Association, Delia Javaya. Delia?
Good morning. Thank you, Governor Pritzker, Lieutenant Governor Stratton, and all the legislators who are here today. My name is Delia Gervier, and I am proud to serve as the Executive Director of the Alzheimer's Association Illinois chapter. Today is a good day in Illinois for people impacted by Alzheimer's. With the signing of Senate Bill 677 and House Bill 848, Illinois is leading the nation as we seek to be a dementia-capable state until a cure or prevention is found. Dementia is an epidemic, with 230,000 Illinoisans living with Alzheimer's, supported by 381,000 caregivers. Alzheimer's particularly impacts communities of color, with African Americans living in the United States being 50% more likely to develop Alzheimer's disease than their white counterparts, and Latinx Hispanic residents being 33% more likely to develop this disease than their counterparts. Further, only 45% of people with Alzheimer's disease actually receive a diagnosis. By signing Senate Bill 677 into law today, we will start to change that here in Illinois by ensuring that all licensed healthcare providers who see adult patients have at least 1 hour of ongoing dementia training. This training will assist healthcare professionals in making a diagnosis or referral and best support their patients impacted by Alzheimer's. Ensuring more Illinoisans living with Alzheimer's get a diagnosis will allow them to plan for the future, participate in clinical trials, and access vital resources. Getting a diagnosis early is critical, as it has been shown that early intervention makes the greatest difference in management of symptoms. Additionally, the signing of HB 848 will help ensure that there are resources in place to support those impacted by Alzheimer's right here in Illinois. The extension of the Alzheimer's scratch-off lottery ticket via House Bill 848 will provide vital private dollars for Alzheimer's care and support, education, and awareness among Illinois. The funds will be essential as we continue expanding our work to help families navigate through the phases of the disease, from getting a proper diagnosis to accessing resources to supporting caregivers. I would like to particularly thank Director Harold Mays and his team at the Department of the Lottery for all their work to make this ticket a reality. On behalf of the hundreds of thousands of Illinoisans impacted by Alzheimer's disease and all other dementia, I want to thank the members of the Illinois General Assembly who support these two critical bills. In particular, I want to thank our amazing bill sponsors for Senate Bill 677, Senator Ram Villaraigosa and Representative Kathleen Willis, and our sponsors for HB 848, Senator Melinda Bush and Leader Natalie Manley. Without your leadership, we would not be here today. I would also like to thank Lieutenant Governor Stratton for your ongoing partnership with the Alzheimer's Association, starting with our listening tour back in 2019, and continuing to today with our joint work to pass the healthcare provider training legislation. Finally, thank you to Governor Pritzker for signing these bills today and for your continued leadership and support. We look forward to continued collaboration with each of you as we make Illinois a dementia-capable state. And at this time, I'd like to call Governor Pritzker back up to get these bills signed.
Thank you to all the bill sponsors for joining us today. Yeah, please have a seat and we'll take some questions from members of the media.
Governor, there's a couple days left before you got to extend your declaration. What are you going to do with the eviction moratorium at that time? Any extensions or changes?
Well, as you know, we've been providing literally hundreds of millions of dollars for people who are in danger of receiving an eviction notice. And so it's our goal to make sure that no one will lose their apartment, their home, whatever it is they may be renting. And it's extraordinarily important to us to make sure that we do it in a quick fashion, that we get those dollars out the door. In fact, Illinois has been named as one of the top states in the entire nation, the top two, for getting dollars out the door to support renters and make sure that they don't get evicted. And then we've worked with the court system to make sure that they're working in a ratable fashion to work through the problems that people may be having, either not yet getting the support that they need from the programs that the federal government has provided, or making sure that the landlords are engaging in the process appropriately. So a lot of work has gone into to ramping down the eviction moratorium, which, as you know, the federal government has extended just till October. So we'll be working with all of the organizations across the state, as well as renters and landlords, to alleviate the pain that people may be experiencing.
Will you be extending it and matching the CDC's eviction moratorium?
We've looked at that. We continue to look at it, and we'll make a decision about that soon. But again, whether we do or don't, I think the important thing to note is this is going to be a many, many months long process so that people don't get evicted. Whether that moratorium is extended until October, which, as you know, is been challenged in court, and there are other issues with it. But either way, people won't be forced out of their homes right away if they are part of this process that we've created.
With the program funds, Governor, real quick, just to follow up on the eviction moratorium, Governor. Governor, just in the state has ordered its teachers to get vaccinated, like in Chicago. I wonder, do you think other school districts should require teachers to be vaccinated, and what risk metrics are you measuring as you evaluate when or how long students should have to wear masks?
We have not required school districts to require their teachers to be vaccinated. I'm certainly encouraging people to get vaccinated. School districts that feel that's an appropriate move, that's up to them. CPS has made that decision on their own. With regard to masks and whether or not there's how long the mask requirements may go, look, I think all of you have seen that this virus tends to have cycles to it and variants. And as a result of that, I don't want people to have to wear masks. Nobody likes to wear a mask, but it is part of the process of keeping people safe and healthy in our schools, especially where we have young people under 12 who don't have a vaccine available to them. And so we want to make sure that there's some progress that gets seen in allowing people under 12 to get vaccinated, to make sure that we see progress in bringing down the number of cases across the state, the positivity rate across the state. We're going to be in this for a little while longer. I'm talking about COVID-19 and the challenge that it brings to all of us. We're going to be dealing with this for some time, it's clear, because there are many people who aren't yet vaccinated, and we want them to go get vaccinated as soon as possible. But the variants are also alive, well, and moving across the world. And they, when you see them hitting somewhere else in the world, you should know that, and I think we've seen this, that it's highly likely that a variant you see hitting some other country is going to come to the United States. And so we have to prepare ourselves for the hopefully ramping down of COVID over a number of months and maybe over the next year. But we have to follow the science, and we'll be requiring people to wear masks in schools to keep our kids safe until we no longer need to.
Governor, with the rental assistance funds, the window closed for landlords to apply for that over the weekend. Your office put out a note saying that guidance allows for direct payments to tenants if landlords aren't cooperative. What's being done to ensure that if the tenants get those funds, it goes to pay for rent rather than something else?
I'll get back to you. I don't think that that's accurate. I want to make sure that I get you the accurate information. All of the programs that have existed are programs that require payment directly to the landlord, not to the tenant, hoping that the tenant will pay the landlord. And so what we're trying to do is get landlords to go online and do what they need to do. By the way, the courts will also be helping tenants with this, and there will be other rounds of support for renters as well as for homeowners. Because as you know, there are many people who've been challenged not being able to pay their mortgages. And so there is money set aside for them as well. Mike?
This one's for Lieutenant Governor Stratton. Obviously, you're very passionate about making sure people are diagnosed and have proper treatment for Alzheimer's. Now that this is signed into law today, how does it make you feel that this is finally happening in Illinois?
Well, it makes me feel great. I mean, all morning I've really been quite emotional as I think about caregivers all across our state who know that it's a great honor to be a caregiver and to care for our older Illinoisans, but it's also a great stress. Financially, mentally, emotionally, it can be very stressful to be a caregiver. And had we had earlier information, then we would have been able to start helping my mom earlier. And so the fact that now, it didn't help with my mom, she's gone now, but in her honor, I know she's smiling today, and she's looking at this moment and recognizing that because of the experience that we had in our family, we are now going to help so many other Illinoisans and older adults in our state. We're working to make this state the best state in the nation for our older adults, and a dementia-capable state, as was mentioned before. So that's what's happening, and it makes me very proud.
Governor, the census out now with the block-level data, what do you anticipate happening with congressional maps? What do you anticipate happening with the state legislative maps? You had said that legislators may need to come back and refresh the map.
Well, my number one concern about the maps is just to make sure that we're recognizing the diversity of our state in the way that the mapping is done. And, to the extent that there are changes that will need to be made, that's certainly something the legislature will need to take up, and I'll consider.
Governor, heading into a re-election year, how can you snub the biggest downstate Democrat rally in person? And are you that confident you can win re-election without them?
I love the way you frame that question. I'm unable to attend the breakfast that you're referring to, but I did just record a video for that breakfast. So many people are attending that breakfast that are my friends. Everybody there, Democrats from across the state that I have worked with for the last, really for 4 years, because during the campaign, as well as governor. These are my allies and friends, and I hope to see many of them later in the day when I'm able to attend the Governor's Day event at the lawn. Sorry? Well, no, but so has COVID, my friend. So as you know, there were challenges that came up as a result of the COVID-19 variant that's among us. And when that change was made, I made other plans as well. And so I'm looking forward to seeing everybody at the fairgrounds. Look, we're one party. We're friends with one another. We support one another, and I'm working very hard to elect Democrats up and down the ticket wherever I can. One more thing, I'm very excited about the idea that working together, that we have attracted many candidates for all of the races all across the state of Illinois, and I'll be working through Blue Wave Illinois and other organizations to make sure that they get elected.
Can you say what your other plans are?
Sorry?
Can you say what your other plans are?
What do you mean?
Instead of this brunch?
I made private, these are family plans that I made at the time. Listen, as you know, I think you've seen me here every day at the fair, and busy all day with lots of activities, and will continue to be here. And so when there's been an opening that gets created in my calendar, being able to spend time with my kids, my family, that's something I look forward to doing. So thank you very much.